The views expressed on the Jerry Cahill CF podcast are that of Jerry Cahill and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing on the Jerry Cahill CF podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Jerry Cahill CF podcast presented by the Boomer Esiason Foundation and jerrycahill.com.
Welcome to Jerry Cahill's Living, Breathing, Succeeding podcast series. This show, CF medication insurance and prior authorization, has been made possible with the financial support from Mylan. Today you'll meet James Colligan and Danielle Maffei. James has worked in the area of cystic fibrosis for over 16 years. That included working for one of the pancreatic enzyme pharmaceutical companies, and is the Director of Sales and Business Development for Total Care Pharmacy. Danielle is the lead CF pharmacist at Total Care and will be reviewing the prior authorization process today.
Hi, my name is Danielle. I work at Total Care Pharmacy. I'm the head pharmacist for cystic fibrosis and pulmonary issues. I'm from Staten Island, and I really love to read, I love to draw, I love to paint, all that stuff.
Hi, my name is James Colligan. I'm born and raised in New York, attended Boston College University and graduated in 2003 with a finance degree. My first job out of college was with CF Pharma, a CF company, and I'm currently married for a little over a decade and have two wonderful children, Genevieve and Brendan. So I had actually never known or heard about cystic fibrosis prior to my first job out of school with CF. And once I got immersed in the CF community, I was doing sales, meeting a lot of the community. I really loved all the people that were a part of that community, the patients and the care centers, the doctors, the dietitians, and I've been in it ever since. I started with Total Care less than 3 years ago. After our CF team was let go from the pharmaceutical company, and the goal was really just to make this into a top of the class white glove CF specialty pharmacy.
For insurance coverage, there are a lot of different kinds of insurance coverages. Most importantly, there are government plans and then there's commercial plans. So for patients, usually they could either have Medicare, which is broken down to three parts. It's Medicare Part A, which is the hospital coverage. Then there's Medicare Part B, which is your medical coverage, but sometimes some of your inhaled medications will go to Medicare Part B. And then Medicare Part D will cover the rest of your drugs that are not your inhaled medications. And then otherwise, there's also Medicaid, which is also a government insurance. And then there's commercial plans that are usually through your employer.
So as a CF specialty pharmacy, some of the things that we like to do to help CF patients is help them with their financial burden. And there's various ways that we can do that. If you have commercial insurance, most of the branded manufactured drugs all have programs around their medications.
The enzymes, they do have manufacturer programs that will help with copays. And besides copays, sometimes they will give you nutritional support as well. So for like your vitamins and supplements, sometimes they'll give you shakes or like nutritional supplements like that so that you can help to adequately take advantage of the program and make sure that your nutritional needs are met as well as your copays.
A good majority of CF patients understand some of the programs that are offered, but there's so many different programs and there's so many different medications, each with their own program, that can be very easy to get lost in the mix. Say you have a 30-year-old patient with commercial insurance, that's on a pancreatic enzyme, Pulmozyme, Vertex medications, makes $40,000 a year. There's 5 different things just in that comment that they could be eligible for. They may only be taking advantage of 1 or 2 of those things. And then the other 2 items that they could be helping out with are something that they're missing out on just because they didn't know those other programs existed. So what we try to do is educate the CF patients. Okay, we know you're on Pulmozyme, we know you're on this pancreatic enzyme. These are 2 programs that might work for you. And as a specialty pharmacy, it's important to ask, if you do have copays for your medications, are there things out there that may help reduce those copays so you're not paying out of pocket for them? Well, prior authorization can be a request by your insurance company to get additional information before they're going to approve your medication or thing that you need for your disease state.
When you have to get a prior authorization done, the doctor will usually gather up the clinical information that basically says why you need this medication.
What we can go back to do is we talk to the referral center and say the insurance company is requesting additional information, send the patient's cultures with this form to the insurance company, and maybe 24 to 48 hours later, the insurance company will approve the medication. But you have that prior authorization step that takes a few steps before you're able to dispense the medication.
Usually it's not for your general day-to-day antibiotics if you have acute antibiotics, but sometimes medications such as tobramycin, pulmozyme, those medications will require a prior authorization.
There are things that we can do as a pharmacy to quicken the pace of the process. So if we get a prescription for an antibiotic, we'll call right away. We'll rush the prior authorization. They have different departments that will do these things quicker. We most recently had a patient from the Akron CF Center that had already had a prior authorization denied for Toby Podhaler that we actually had nothing to do with. But they were asking if we could help them on the appeal process, which is the next step of a prior authorization. And we helped consult them with the appeal, some of the language that we think would help the insurance company convince that the patient needed this product. And we actually got that verdict overturned, and the patient was able to get their medication that they wanted. We currently have CF patients in 48 out of the 50 states. And we work with almost 70 CF centers across the entire country in one way or the other. Because the CF centers have so much to do and so little time to do it when you're coming there to see them, we want to take some of that administrative burden off of them. So we'll help patients sign up for the HealthWell Foundation. We'll help patients sign up for any of the manufacturer programs, the pancreatic enzyme programs and things like that. We'll even help patients on a monthly basis make sure that they're staying compliant with those programs or re-sign them up for their HealthWell grant. So things that the centers don't have time to do because they're busy caring for you. If we're able to do it, we want to make sure that we're taking that off their plate. So the HealthWell Foundation is an amazing organization that's a tremendous resource to CF patients that we encourage all of our patients to look into, and we help actually our referral centers sign up patients for the HealthWell grant, because that's something we can do as a specialty pharmacy. We have our own portal with the HealthWell Foundation. CF patients can either call the HealthWell Foundation directly, or they can go out to healthwellfoundation.org and try to apply for the grant. The only thing that would ever keep you from getting the grant is if your family income is above those levels. So if you're a single person and you have a good paying job and you make $80,000 a year, if you're above that threshold, they may say, I'm sorry that you're denied for the grant. But if you have cystic fibrosis and you're within those income levels, you would get approved every time.
If you're having trouble getting access to your medications or copays, it's important to communicate this back to your doctor's office, especially. The pharmacy should help you to get copay assistance if you qualify for that. But if you find that you can't find that copay assistance, it's also important to communicate that to the doctor's office, because usually they have dedicated social workers, or your CF team should be aware and knowledgeable on helping you to get copay assistance if it's possible. So it's really important to communicate it back to the team if you find that you're paying copays and you don't think that you should be.
Unfortunately, with the U.S. Insurance and everything that goes on in this country, there are always patients that will skip medications or try to lengthen medications because they can't afford it. And obviously that's something in our world that we want is unacceptable, and we want to make sure we're doing everything in our power to make patients be adherent. If we can help patients lift the financial burden so they're not making choices between what medications they can and cannot get, we're going to do that. We would never deny a patient their medication because they can't afford it. We can always come to some type of agreement or help to make sure that if you're prescribed something because you need it for the best of your health, that you're going to get that medication.
Communication is key, especially with your CF team, so that they can help you to get your copays as low as possible.
We make sure that when a patient leaves with their prescription from our pharmacy, they should not be paying $1 more than is the lowest possible. So we're going to make sure that we're taking all these steps for you from all the various things that we talked about to make sure you get the least expensive option possible. You're going to have a dedicated team here that reaches out to you on a monthly basis and says, hi, we're just checking in to see if you need refills of X, Y, and Z. Every time you call up the pharmacy, you're dealing with the same technicians and the same pharmacists to answer your questions. So you're not going into a CVS on a random day and the person covering that day has no idea about your medications, your disease state, what you need, what your copay programs are, anything that can help you. You have a dedicated team here that is just dealing with cystic fibrosis and lung transplant to get you the best outcomes possible. So anyone that would like additional information or even just have a question on anything that has to do with their CF medications or any of the grants or anything that we talked about today, we have a website, totalcarerx.com, that they're more than welcome to go to. People are always more than welcome to email me, and it's quite simply jcolligan@totalcarerx.com. There's millions of things we can do, and there's no pressure to ever do any of our services. If you just have a question or I'd like more information about this program, I've been in CF so many years now, I feel like I can navigate you or at least point you in the right direction to help you get the answers that you need.